what questions should they be asking their doctor?
You should ask for a PSA. Some of the guidelines say that some of the guidelines don't recommend PSA screening. Some doctors follow those guidelines. And at Kaiser, I believe they stopped screening. Their policy is to stop screening at either 65 or 70.
Okay.
So they won't even tell you that they stop screening. They just will stop screening. So let's say that you're, and I know of a patient that, you know, his PSA was slowly going up, and then he reached a certain age and they stopped screening him. And subsequently, he was found to have significant prostate cancer. So you should be proactive. I think that you should be screened. It doesn't mean you should be treated if you get diagnosed as having low risk disease. You might want to do active surveillance. But I do recommend that Black men get screened for prostate cancer.
Okay.
So the main take-home message is when you go see your primary care doctor, don't ask him whether he thinks you should be screened. Tell him, I've been watching, I've been listening to things. I would like to be screened for prostate cancer, period. The other thing is that nowadays people have access to their own electronic medical record. So you should learn how to get into your own chart. And if you learn how to get into your own chart, then you can look back over your PSAs that you've had over the last 10 years, and you can look and see if there's a pattern. Trying to ask somebody to remember what their PSA was 2 or 3 years ago is a little bit much to ask. But if you can look into your electronic medical record, then you can keep track of your PSA, your cholesterol, all kinds of things.